This is Behind the Breakthrough, the podcast where leaders behind the UK's most complex transformations reveal what actually drives breakthrough change. In this episode, we speak to Ayub Bhayat, a multi-award-winning transformation leader in the NHS, Director of Data and Analytics within NHS England, and someone at the heart of shaping programmes like the Single Patient Record. Ayub tells us the truth about what is broken, what might actually work, and what it really takes to change a system millions rely on every single day. He is someone who's had a front row seat to some of the most difficult calls in recent NHS history, and who now is helping to decide what comes next. Having seen it firsthand over a number of years, he's one of the most driven people I know in the NHS. Welcome, Ayub.
Thank you, Fayaz. It's great to be here with you.
Excellent. So to people who don't know who you are, what you do, can you give us a kind of explanation about what you do in your role, what that involves, and the kind of change that you're driving?
Yeah, sure. So I'm Ayub, as you said. I've worked in the NHS and as a public servant for the last 20 years and counting. I joined the NHS in 2005, 15th of July. 2005, and I got married on the 29th of July 2005.
One thing led to the other, obviously.
But as my wife says, I've been married to the NHS longer than I've been married to her. I started in the NHS in various different roles. I've worked in hospitals, I've worked in primary care trust, and then also latterly in the centre. In between, I worked in a commissioning support unit also. And the NHS is a complex environment, and my role is to try and bring data-led solutions to change how we operate on a day-to-day basis, to change how the NHS operates on a day-to-day basis. So whilst I have some responsibilities in making sure the centre, NHS England, and the department have the right information that they need to manage the NHS and manage the performance of the NHS, and that we're providing modelling capabilities and analytical capabilities. I also have the other side of my role to make sure that we're maintaining big national systems and platforms, and then also delivering large-scale transformation programs like the Single Patient Record, the Federated Data Platform, event-based architecture, and how we use AI to really transform how the NHS operates.
And can you bring it to life from a patient's perspective? So as they use services, what are the types of things that you and your team at large kind of help support with? Things that we might see, you might not see?
So a lot of it is in the background. So what my teams do on a day-to-day basis isn't generally visible to the patients, but we help change their experiences, both of a clinician and a patient. So, for example, how quickly a patient can be seen in a hospital because they're sitting on a waiting list and they need to be scheduled into a theatre. We provide the tools to do that. So those are tools developed by our teams and are deployed to hospitals. And as a result of those tools, patients are seen in hospitals sooner. So a lot of those capabilities are sometimes invisible to the general public. However, on a day-to-day basis, they make a difference to thousands of lives, if not millions of lives, over a larger period of time.
And just going back to what you said about your career, you started off as an analyst and now you head data analytics. Can you kind of talk about how you made that jump? Are you still an information analyst at heart? I know you've said to me previously.
So I am an analyst at heart, and that is a given reality. That's where I started my career as an analyst. I learnt how to use data, and I've always had an interest, if you like, in how to use technology to automate some of the simplest tasks. So I was always probably more of a technical information analyst, I'd say, rather than just a normal information analyst that looks at data, produces insight, and provides reports to senior stakeholders. My interest was always slightly broader, to say, how do you actually change things? How do you create a workflow? How do you create different capabilities? And how do you apply science to the analytics that you're performing, that it can preempt something? So yes, I'm an analyst at heart. I started as a very junior analyst in the NHS a long time ago, and then was fortunate, had good mentors along the way, was nurtured very well, was trained very well, and thank to God first of all, and thank to lots of other people, I've managed to progress to lots of different places and into this position today. And then the pandemic gave me lots of opportunities as well. So during the pandemic, I was able to contribute quite significantly. The pandemic was quite a personal issue to us as a family. We lost quite a few members of our family passed away during the pandemic. So it became quite a personal mission to contribute. So I worked on all different parts of the pandemics, from ventilator allocation to PPE distribution to the vaccine program. And then played quite a significant role in developing systems and technologies that recorded the very first vaccination given to Margaret Keenan at the time. But then also, how do you report on data faster? How we put a public dashboard in place? All of those things are areas that me and my teams have contributed to. And you're only as good as your team, right? So it's never about you. It's always about the people that you work with.
And interesting, you talked about it's about the team. You've recently, or you and your team recently won the National Tech Awards for the best tech team of the year. Sometimes the NHS or health service in general gets a bad rap for being a bit of a laggard, technology laggard, but your team won that award. Given that you manage such a large team, how have you been able to run such a diverse, kind of high-performing team?
So first of all, working in the centre, there is lots of complexity, right? And recognition sometimes is hard to come by, not from your seniors, but more so from others from outside in. One of my big messages to the whole of my team, so the whole of data and analytics, consistently is we belong here, right? Everybody belongs in this team, and we've created a home for everybody. It doesn't matter where you're from, what your background is, what your religion is, but you belong in this team. And I think that has really helped unify us. We're all here for the same reasons. We're here for the reasons of actually doing good for the public, doing good for the wider NHS staff. So I'm really fortunate to be surrounded by some fantastic individuals in the team. And collectively, we play that role of creating the culture. And that culture is really important. Now, this is how you win an award of Tech Team of the Year, because everybody's unified on the same mission. Everybody's there. Everybody's driving towards doing good. Recognition follows. Yeah, I had a boss a long time ago, and he would say, "Don't follow the money. Right? Money will come to you when you do good work." I totally believe in the same thing on recognition. Recognition is something that will come when you do good work. And that's true for the team here. Tech Team of the Year isn't an easy accolade to achieve, especially when you're not just competing against your NHS peers, but actually industry peers.
And can I probe on that? A lot of technology we talk about as being transformative, and you mentioned it a few times. Talk to me about what is so transformative about technology. Why is it important to put transformation above the tech itself?
So I guess we've seen a sort of sea change, right, in the last 10, 15 years, I'd say, in technology, and how technology has become sort of part of everyday life, even more so than it was, right? The big part on technology and technology-led transformation is, historically, it's been seen as, we've got a transformation director here whose job it is to look after transformation, and we've got a technology director or a CDIO here whose job is to look after technology. A lot of that for me is coming together, and they are becoming more and more one of the same, because it's to achieve a digital-first NHS, which is the 10-year plan vision, you're going to need to make sure digital and transformation sit hand in hand so that you have a digital front door. That is a change. To do that, executive ownership and chief executive level ownership of digital transformation is going to be crucial. Exec teams and boards within organisation are going to have to be much, much more involved than they have been and are today, to make sure that they're scrutinizing technology investments, to make sure that technology investments are truly transformative to deliver patient care. And also along that same journey is changing the experience of our workforce. So for me, that level of transformation and tech transformation it is only going to happen if we've got the right level of ownership right across the organization's board.
Yep.
That then bleeds down, because if ownership starts at the top, you've got to also filter it down. And I talked about culture earlier, right? And you've got to make technology-led transformation, a digital-first NHS, a digital capabilities part of everybody's role and responsibility. That basically means you've got to embed it within your culture. How we do that is easier said than done. But every organization, based on its own individual culture currently that exists in the NHS, will have a slightly different approach to this. But there's probably 5 or 6 patterns that you can sort of systemize and have a playbook around it to say, these are the key things that we've got to get across to the NHS.
And what would you say to some people, the naysayers, who might say technology doesn't work, it's too slow, we've tried it before, technology isn't actually the future, we need to go back to boots on the ground, go back to the things that we know work?
I don't think they believe that when they say it. I think sometimes people say it to be provocative. I don't think many people believe that. Your life, my life, has changed now in personal capacities, right, with technology. So the way you would watch television, for example, to how you watch television today. I don't watch BBC One or ITV or Channel 5 very much at all. My way of watching television is using mainly things like Netflix, or Prime or Apple TV or Disney. That's how I watch television now, because the way I used to watch television is quite old-fashioned, right? And this is a more modern way, a more contemporary way to live my life, because I'll watch it when I want to watch it. The same is true of actually meeting patients. Meet them where they want to be met. Give the clinicians what they need. So I think those the naysayers in this space, no, none of this stuff works. I don't think they believe it themselves. And I would say that it's already here. We're already doing transformative things with technology, be it ambient voice technology, or the NHS app, or the single patient record that's coming down the line, or the FDP. There are so many things that we are already doing which are hugely transformative, and that's technology that we have available to us today. Those innovations are happening in this NHS right now, and globally.
To people working in the NHS who are seeing things on a day-to-day basis, sometimes it can become easy for them to not see where technology is almost playing an invisible hand, helping them in the background. Can you bring to life some examples of where technology is being used to really drive transformation, where the UK might actually be an international exemplar?
So you probably would expect me to go here, as it's one of my areas, but in how we use data and how we use data with the Federated Data Platform, we are an exemplar globally. We are a massively federated system in the NHS. No one organisation is the same. There are lots of non-standard practices between hospitals. They may be standardised within a hospital, but they are non-standard between hospitals. And we have different approaches. Fundamentally, it's just the same type of activities, but they are done differently between hospitals. And with the advent of FDP and the rollout of FDP, the example I'll give you is how you schedule a patient into theatre. It's a simple example, but actually, for a clinician, you're interacting with 4 different technology systems before you get to put a patient into a theatre. Well, actually, if you unify the data and you let the data speak to the clinician to say, well, actually, this is the best slot for this patient based on their suitability. It's done the checks for you, and you just press book. That's how you should those are the things that we should be making easier. I met a consultant. I won't name the consultant, but I met a consultant surgeon, a gynecologist, who said to me, "Ayub, I've got this fantastic robot. So there's a Da Vinci robot which does surgery. Fantastic technology, fantastic innovations that we have to undertake procedures, and they can do so many extra procedures in a session now as a result of having a robot do some of those. And if you've not seen it, it's actually really, really impressive in how this works. But this consultant was talking to me and said, I've got this fantastic robot technology that I can do more surgeries. My problem is I can't book the patients in to fill my theatre slots because it takes too long. And the FDP actually now allows him to book his patients in and fill his list so that he can maximize the use of his robot. And that is two different innovations, if you like. One is a surgical innovation and one is an administrative innovation. But ultimately, the beneficiaries in this are patients. Patients are being seen. Patients are being treated. These are things that are happening right now. And I'm really proud of the role that we have played in making that happen.
And you're at the heart of delivering some of these big national scale transformation programs, digital transformation programs. What is the hardest part of delivering change at such scale?
So I said a few moments ago that the NHS is a massively federated system, which basically means every organisation is sovereign. And the NHS sometimes does suffer from not built here syndrome. And it's important that we call that out. And it's important that we challenge ourselves as an NHS to make sure that we are pushing innovation to be adopted at national scale. So a lot of the things that we do are actually built bottom up, which we then help scale. And sometimes the biggest challenge to getting them adopted in different organisations is, they built it down the road. And we can do better. We've done this. And too often I've seen many people allow perfect be the enemy of good, right? And somebody said to me a while back, carpe diem, the time is now.
Seize the day.
Exactly. And we've got to make sure we seize the day right now. We've got to make sure that we don't let perfect be the enemy of the good, right? The NHS is suffering. The NHS is, since the pandemic, we've got really large waiting lists. We've got massive challenges. We've got to increase productivity. We've got to, technology-led transformation is how all of those things can be better. And ultimately, the beneficiaries of those things are patients and the public. And we've got to make sure we do this because we owe it to them.
So the hardest part of the transformation isn't the tech, it's the change element. One of the challenges often cited in the NHS is everyone's digital and data literacy, right from the C-suite level all the way down to people and patients. Do you see this as a challenge, and what do you think needs to be done to kind of help overcome that digital divide?
So that is a great question, right? It's one of my favoured areas that I want to actually really make an impact on. And it's probably got a multifaceted answer within here, because how you upskill the C-suite to the shop floor are probably two different approaches. And I think all the people in between as well, that you need to bring along the journey with you as well. So I think how we run structured development programs for the C-suite, going back to what I said earlier, transformation needs to be owned, and digital transformation needs to be owned at chief executive level of an organisation, and that's going to be really important. So you've got to set programs and development days specifically aside to say, we have board development days on a regular basis, but actually 1 in every 3 should be around digital and data development for the board and the executive team. And I think that's something that we're going to have to massively invest in. But we've just got to reinforce that message. It's the same message I gave you earlier in terms of we're embracing it in our personal lives. we need to embrace it in our working lives. AI is here to stay, technology is here to stay, and we've got to maximize its impact. Then, from the shop floor perspective and everybody in between, I think there's a massive educational thing that we've got to do here. And what I mean by that is the nursing schools, the medical schools, we've got to instill within the curriculum for all of the new doctors and nurses, radiotherapists, allied health professionals, all of the clinical teams that are coming through the education system, that we start to do technology education as part of their courses, that it's fundamental. But we've got to set a level of expectation of, when you come in, you will have access to this, this, and this. And there's got to be a level of ubiquity within there. Right? So universal deployments of certain technologies right across NHS, so that the workforce of tomorrow know what to expect when they come into the NHS to support the delivery of care. Everybody who's there right now, you've got to set up different programs for them, and their development also matters. So I was speaking to a resident doctor recently, and she was telling me about this wonderful innovation that we've done in terms of generating discharge summaries using AI. Fantastic program of work, and she said to me, I've been so used to typing up discharge summaries on a regular basis that I didn't realize how much it was infringing on my personal life. But through this program of work that I've done with you guys, I've been upskilled. I've started to use technology, and it's giving me a better quality of life. So sometimes I think what we fail to do very well is explain the benefits of technology and what they really mean, and how you upskill all of the staff that are there, because everybody's so used to working at 100 miles an hour. Actually, you can slow down a little bit and take a bit of time for yourself, because you're already doing more than your allotted hours or your sort of time commitments. You're already doing lots of free overtime. There's lots of goodwill that public sector staff as a whole give to public sector organisations without being naturally remunerated for, and we can improve their quality of lives.
That's really helpful and clear for staff. What about patients as well? Do you think there also needs to be a parallel program for them, not just for the benefit of NHS, but also wider public services?
So a much broader topic, and probably a different answer for this for that group and the biggest group, our patients and the wider public. We've got to help them choose better. Again, a bit like what I said earlier, we're accepting in our personal lives. For patients, this is their personal lives. For citizens, this is their personal life. And I think there's an easy pull here. A lot of the technology that we deploy out there through things like the NHS app, they want it. They want to engage with it. We just need to organise it better for them to receive it. I think they're ready for it. They want to choose better. There is this saying that the British love to wait, right?
And
queue, exactly. It's such a British thing to do. So we take this thing as it's a sort of badge of honour to queue. It's not a badge of honour to queue. We've got to change how we deliver healthcare. We've got to reform how we deliver healthcare. That basically means we've got to recondition the general populace of this country, and actually, no, you don't have to queue. You can go through the NHS app, we'll book you an appointment, and you can be seen, right? That's the experience that they want, and we've got to give them those experiences. That's, again, improving their quality of lives, improving their outcomes. You don't want to be in a hospital in an A&E department waiting for an appointment or waiting in the queue to be seen, right? So I genuinely don't think there's very much for us to train. It's a bit like banking as an industry. 20 years ago, you could walk into your high street and go to how many branches? Right, there were so many branches, but there's no more banks. There is no more banks, bank branches there, which is crazy, and we've lost so many branches. But if you think about it, do you need to go to the bank anymore? I don't. I do everything through the app. Who's trained me to do that? No one. They've pushed out some reminders, some sort of tool, some tips of how to use it. And then I remember about a year ago, I got a check through the post for something. I can't remember what it was. But I got a check through the post. I thought, oh my God, I've not had a check in years. What do I do with this? My branch is closed. Where am I going to go? And I found a feature on the app that I can scan the check and they will cash the check. I was like, wow, that's brilliant. So nobody's trained us to do that. We've just learned it. I think that the British public is very, very well educated and are ready to receive those sorts of things from us, from the NHS. They want it, they expect it, and we've got to give it to them.
And I completely agree. But there will also be a component of the public who aren't quite digitally enabled, who are, if you like, left behind or choose to be not as savvy as others, who can't use a phone, etc. That must also be on the top of your mind. How do you help make sure that you support the people who want the technology with the most advanced solutions and care, and also the people who don't quite have the same access?
So, coming from an immigrant family, ultimately, this is a real issue for my mum. My mum's the only person who doesn't speak English in my family. My mother-in-law doesn't either, but my mum probably speaks even less than my mother-in-law does. My challenge to my mum has been, so on the 1st of June, my GP practice has been sending texts out and saying from the 1st of June, we won't run the 8 a.m. call rush to book appointments. You now need to complete this online form. So you call the practice, you press a button, and they'll send you a text, and you complete this online form. So that's what they've said. So my mum's like, well, how do I book an appointment? I don't know how to complete a form. I don't speak English. And they didn't send anything else out. That was the first message they sent out. So alienating a part of our population is really problematic, and we've got to make sure that the health service remains for everyone, not just for the few, right, who are digitally literate. And we'll all have parents, grandparents in our families who will be in this sort of situation. So it's personal to us, right? And my mum is no different. And my dad said, well, I'm going to have to, because my mum's got a few health conditions and she has to go to the doctors on a regular basis. So my dad said, I'm going to have to wake up with your mum at 8 o'clock to fill the form in, which is obviously a problem for my dad as well. They're both retired. Subsequently, over the last few days, and I think they probably got lots of queries at the GP practice, they've since rectified it and said, you can come into the surgery and ask for help to fill the form in, right? But again, that's a journey to the GP practice to go fill this form in for triage. So I think there's some teething issues in terms of how you do this, and we've got to make sure that we don't exclude, as we run towards a digital-first NHS, and we do need to run towards a digital-first NHS, we don't forget the few who won't have those skills, who won't be able to engage with digital technologies in the same ways that we want everybody to engage. And we've got to make sure that the NHS doesn't inadvertently forget about a group of individuals who probably in some places are some of the most vulnerable people in our society, and that need to be cared for. So we've got to make sure that as you create digital first services, what is my solution for those who are not digitally literate? How am I going to provide their services? And asking that question of ourselves all along the way is going to be important. And there's going to be different solutions for different areas and different things that we try to do to achieve a digital first NHS. So in this situation for my mother, yes, they've got a route, but I think there could be better ways of doing that. So for the few, yes, you can press this button and actually speak to an advisor to book an appointment, who will triage you there and then. So there are different ways.
So using technology, even still, to help the digitally less savvy and enabled.
Correct. And to be fair, in my mum's situation, there's nothing stopping translational services. So my mum is literate. She's just not digitally literate. In her situation, technology has moved on so far, and there is fantastic voice technology. you can pick your language settings. You can ask the questions in a different language, which can then be translated through AI, which can be put back into the form, and the form can still be generated to see, when you're triaging the patient, do they need to be seen? So there are ways and mechanisms and methods that you can deploy to simplify, even for for those who are not digitally literate.
And how do you go about addressing what I think is quite a unique problem for the NHS, which is when you're building a technology solution or a solution generally, you do have to cater for everybody, absolutely everybody, in a way that other industries, other services can kind of cater to a cohort of people. How do you overcome that? Because you're dealing with people who are digitally literate, not literate, people who are blind, people who might be deaf, people who might need a care, and so on and so forth. How do you deal with that challenge?
So service design is a big issue, right? And again, providing consistency of services, not a postcode lottery, services being deferential from one area to another, is a massive challenge for the NHS, and those has always been a challenge for the NHS. We do it right more often than we do it wrong. I think that's also a fact, and we need to be clear about that. And designing designing a service for everyone rather than just a few is absolutely crucial to that. A lot of this comes back to the government's reform priorities, I would say, and I think there's some fantastic ideas within the 10-year health plan, specifically around neighbourhood health, and that is designing for the many, not the few, and how you're changing to deliver care for the many in that through that process is absolutely crucial. We need to start meeting patients where they want to be met, and how we design those services needs to be done through consultation, needs to be done through understanding the general populace and patient needs, to make sure that when we're designing new pathways of care, when we're equitably trying to deliver care across the country in a sort of uniformed way, we are maximizing our capacity, we're maximizing our space, but we're also giving the best possible experience to individuals. So it is not an easy thing to do by any means, and I think the greatest example was, and I know it's a very simple thing in very many ways, was to vaccinate people, right? Generally, COVID vaccine or flu vaccine, it's the same thing for everybody. You'd receive it, I receive it. You may go to your GP practice, or you may go to your pharmacy, or you may pay at a different pharmacy to get a flu vaccine. But it's just a jab in your arm, right? So we did that really well during the pandemic. We made that ubiquitously available across the country. We made sure that everybody got a vaccine, but that's a really simple service.
One of the flagship announcements the government has made, which I know you're at the centre of, is the single patient record. Can you bring to life what it is? Why will it be so transformational? How will it change things for the patient?
Where do I start with this? This is a fantastic program of work. It's a really ambitious program of work, and the interesting thing here is that most of the public think we've already got a single patient record. We don't. The NHS is 200 plus different organisations, plus 6,000 GP practices, plus other social care organisations, plus others, right? Plus third-party private sector healthcare providers, and then third sector organisations as well. So there's so much information held in so many different silos, which isn't really connected. There's been a fantastic initiative called the Shared Care Record, which has been around, which is quite local. It's to your individual system. So, for example, where I come from, Leicestershire, they have Leicestershire and Rutland. They have their own shared care record instance, but it's only for the patients within that boundary. So, if Fires comes from wherever you live, Surrey, into Leicester, it doesn't have your details. So if you are seen in a hospital, it doesn't really know much about Fires, right? And that information isn't available to the clinician. So if you've got other conditions that the clinician needs to know about, it doesn't really know. What we're trying to do is, this is across the whole of England. It will cover every single citizen in this country. It will provide that information to make sure that clinical staff can provide the best possible care. to that individual. It will help you as a patient having to stop repeating yourself and give the most pertinent information to the clinician. It will give a more complete history, your observations, your historical observations, your heart rate, and in time it will also allow wearables data into the single patient record. But then also, as a citizen, as a patient, I will get the ability to see my record on the NHS app. That is liberating, right? So for a general member of the public, a patient or a citizen, seeing my whole record on the NHS app right in front of me will be fantastic. And then you say, okay, what does that really mean? And we've talked about technology quite a lot in all of this today, right? But we start to think, well, actually, I can do self-triage. I can put my symptoms in because the app already knows all my history.
Mm-hmm.
And it's structured in a way that it can use my history and triage me based on my conditions right now. And ultimately, you start to, think big, grow big, right? Transform big. And you start to think, well, actually, I will meet you where you are as a member of the public. And you start to think about the whole journey in a very different way. So you start to say, well, I've got a condition. The app will diagnose you. The app will say to you, yes, Mr. Tirmidhi, you need to be referred to a secondary care consultant. I'll tell you what I'll do, because I'm connected to the hospital systems already, I will refer you. And I found you an appointment. Now, based on your diary and your availability, this slot here looks perfect for you. But you'll do that through talking to the app. That's the vision for the future, right? That's what I want. I'm sure that's what you want as well. That's how you want to interact with care. Being very clear that through the app, you'll be able to have that experience and that journey as an individual where, because of the single patient record, because of the other features of the NHS app and how we transform patient-facing services on the back of that, you are able to experience care in the way that you should be, and you should be entitled to experience that care in a much more modern way.
The way you were talking almost sounded like you have a physician in your pocket, a doctor in your pocket. You can ask the question, that's in your pocket.
That's the line from the 10-year plan, right? A doctor in your pocket, or as we say it, healthcare at your fingertips, right?
Yes.
So that's what we're trying to drive here. We're trying to change the way we operate completely. And this is an opportunity, right? This is a really big opportunity. And yes, we will provide services that will probably deal with 80% of conditions very quickly. But there's some deep transformation to do in certain areas. Now, some of the most frail of our population, how do you look at frailty differently as a result of single patient record? Or how do you look at maternity care very differently as a result of the single patient record? How do you join up between community and primary care very differently? What information do you consume in a technology-led way, so through APIs or application programming interfaces, which are just connections of data? How do you do that in a different way so staff can have that access to that data in a very seamless way to a patient? I know exactly what's happening about me when I want to know about me. To actually that data that underpins the single patient record being deeply transformative to plan and coordinate my care better, because the planning team, which sits outside of direct patient care, have got access to my data to make sure that there's the right pathways that need to exist for my care delivery, to researchers and life sciences organizations being able to have access to our data in a secure way, where we maintain privacy, where we are securing our technology boundary from cybersecurity incidents, etc. Right? But they can come and do research and find cures to some of the biggest challenges that the NHS and our population faces, and that those things will help our economy grow as well, because we will be at the bleeding edge of delivering research trials in this country where cohorts of population can be found and put on advanced trials soon.
So is this genuinely a global first, do you think? Is there anyone who has a comparable system or type of technology like the single patient record?
Probably not at the scale that we're doing it, right? There are a few globally who are doing it, but not at a 60 million population level. This is a first at that sort of footprint, and you can see the smile on my face, I'm sure. But it's an extremely ambitious program of work. We've got to be ambitious, and it will take some time. We've got to get the foundations correct to make sure we do this well, and we deliver to the expectations of the public, and our staff.
And it sounds, smile on my face as well, it sounds ambitious, it sounds exciting, the vision is exciting too. Devil's advocate, the NHS, anyone who's worked in the NHS will know there are hundreds, if not thousands, of systems even within a particular organisation, and the promise of the single patient record is to connect those systems, provide access to data, as you mentioned. Isn't that going to be really tricky? Like, why haven't we solved that already? Are we going to be able to solve it with the SPR? What makes you think that we can do it this time?
If it wasn't tricky, it would have already been done. Right? This is a complex program of work, and you're right to ask that devil's advocate question. And I think we go into this program of work eyes wide open, knowing how complex it is, knowing that it's going to be difficult, knowing that it's been tried before and we've not really succeeded in the same way. And we've got to learn from the past. This isn't just about the single patient record. The whole theme of our conversation has been one of transformation. This is a transformation program, right? This is about how we transform and connect care, right? So the single patient record is about transforming and connecting care delivery. That's what we're doing here. And we've got to bring the culture into that transformation. So the cultural elements that need to be true for this to be successful. And there's been so many different amazing individuals who have come and worked in this sort of space previously, who I met with a few months ago, who gave me some very candid advice of how to succeed in delivering this program. And they've shared with me some of their experiences and their lived experiences, which I try and ground myself in to make sure that we get this right. It's a generational opportunity.
What did they say?
What did they say? Technology is not the hard part. Right? Even though we've got thousands of systems to connect, we know how to do it, Fayaz. We can do it. Right? The hard part is embedding. The hard part is actually making sure it's used every single day. The hard part is changing care pathways. The hard part is adoption. That is the hard part. That is true for every technology program that we do, be it the Federated Data Platform, be it the Single Patient Record, be it the NHS app, or transforming patient-facing services, or ambient voice technology. Right? This is true of all of these technology programs. Adoption, transformation, business change. This is why I have been quite vocal about spending equivalent amount of money on the transformation of services on the single patient record program to the technology itself. So there should be, and I challenge myself regularly, between £5 and £6 of every £10 spent on the single patient record should be spent on the transformation of services. That's where we need to anchor towards.
Fascinating and quite a radical shift, I would suggest, from previous large-scale public sector tech programs that kind of badge themselves as transformation but are predominantly tech with a little bit of transform and run and support in the past. In terms of you talked about change and change on the ground. What do you think the environment needs to be on the ground in order for this technology to be successful for patients and staff?
So we talk about this quite a lot in terms of the NHS needs to be ready to receive it. There is so much change that happens around us, and we expect quite a lot of our NHS organisations, be it general practice, be it secondary care acute hospitals, or mental health and community organisations. We expect a lot of change from them, and that makes it difficult. And we need to make sure that they're ready to receive this change, and we layer it in a way that they are ready to receive that, so that they can see the sort of transformative opportunity in front of them. And then in a similar way, the general public and how we communicate with the public on the single patient record around how it's going to change their lives. And we take the front foot on this. And I'm really keen that we take the front foot on this, that there is active campaigns, because we need to change behaviours. We don't want patients to wait in A&E, like I said earlier. We don't want that. But how do you stop that? And actually choosing better, which is, again, an old campaign the NHS ran probably a decade ago, maybe longer. But choosing better is something that comes to mind for me, because a single patient record will help you choose better.
What are some of the roadblocks that you see on the path to success? Because it's so big, so many people involved, and how do you see overcoming some of those challenges?
So some of the big challenges that we face is making sure that we can keep the general populace with us on this journey, and a lot of that comes to trust, and how do you maintain their trust in all of these things, trust of our staff, and making sure that they are clear in what we're doing with the data that we hold on their behalf. Giving them choice along the way is going to be really important, and we've got to make sure that all of those things come true, and we're doing everything we can. Trust is easy, as the saying goes, trust is easily won but hard retained, right? And we've got to retain the trust. So this is an ongoing activity. Takes one mistake and they lose trust in us. So we've got to make sure that we maintain their trust, and we've got to make sure that we bring them on the journey with us. We've got to make sure that we're on the front foot of informing the public as well as our staff on what we're doing with their data. It's their data, and we can't take that for granted. The vast majority of us vast majority of the population, including myself, want my data to be used for good purposes. I want my data to be held in this country. I don't want it to be held overseas. I want it to be held securely. I want to make sure that the boundary around which my data lives is secured, and is protected from cyber attacks or cybersecurity breaches, both human and computational. Right? So I want to make sure that those things are in place as a citizen, and I'm pretty sure that's what every other citizen wants. But I also want to make sure that my care is planned better. And generally, we're accepting of that in other parts of our personal lives. This is the health service. The NHS, the National Health Service, is trying to help deliver your care and coordinate your care. And it's so important that patients are assured that their data is being used for good purpose.
What would your message be to a young analyst newly joining the NHS who's confronted with so much technology, so much transformation, so much opportunity? Going back to when you were an analyst once in the NHS, what would you say to them as advice for them going forward? So
my message to every analyst is understand the context of where you're working. Understand not just your subject area of I'm an analyst and I know how to do these data techniques. Understand the context. Right? If you have the context information about how the NHS as a business operates, your value increases in terms of how you can contribute. A single analyst, a single data scientist, a single applied AI engineer can probably solve more problems and save more lives than a single doctor can. Right?
Oh, interesting.
That is the impact.
That's motivational. Lovely. Thank you so much, Ayub, for having this conversation. It's been fascinating.
Thank you for having me.
That's it for this episode of Behind the Breakthrough. This conversation has opened up some big possibilities and maybe shifted how you see what it really takes to transform and connect care across the NHS. Healthcare and change are at their core about people, and Ayub is a powerful example of a leader who's built a strong, diverse team and uses data as a tool to drive change and transformation. We've talked about the promise of technology, the challenges of transformation, but above all, how we have to centre service and delivery around patients and staff, where trust and choice matter most. We talked about the importance of NHS ownership of IP, national sovereignty, security. A key point was how we all play a role in ensuring the NHS is ready to receive any new wave of transformational technology so that it can help drive the biggest impact. Thank you for listening, and join us next time as we keep exploring how to make digital health truly work for everyone. See you next time on Behind the Breakthrough.
My favourite movie. I've got a few. So, have you watched Brewster's Millions?
No, I haven't actually.
You've never watched Brewster's Millions? Have you guys watched Brewster's Millions?
No.
Oh my God, guys! What world do you guys come from?
What is it? Who's in it?
I don't know the actor's name, but it's
Okay,
brilliant.
hang up. Okay.
It's a 1980 something movie,
Okay.
right? One of the best movies you'll ever watch. Seriously.
Mm-hmm.
If you haven't watched it, I encourage.
Fryer.
Oh, he's coming there.
There we go. It's one of the best movies you'll ever watch.
I love it.